Very good morning to all of you. So I welcome you all to this physiology session of sleep physiology. It's really funny, right? Early morning, we are learning about sleep physiology. So this nice quote, the first thing that I do when I wake up in the morning is try to sleep again. Yes, that's true, right? All of us do the same. So before learning about sleep physiology, so let's learn what are all the changes that happen when we are awake. See, the sleep physiology is purely based on all your hormonal levels or the neurotransmitter levels, especially the levels of neurotransmitters in your brain. So the variations in or the fluctuations in the level of neurotransmitters of the brain is what is responsible for keeping you awake or responsible for making you sleep. So that's called as the ascending arousal system. So ascending arousal system is basically responsible for keeping you awake, which is otherwise called reticular activating system, RAS. Reticular activating system. So it's mainly present inside the brain and the brain stem. Now let's see what are all the neurotransmitters which are responsible for helping you to remain awake. Three main neurotransmitters whose levels are decreased when you are awake. So what are they? So number one, acetylcholine levels are low in the brain. See, don't confuse this with acetylcholine levels in your neuromuscular junction. When you are awake, in the neuromuscular junction, acetylcholine levels may be high because you do activities, but inside the brain, it is less. So, acetylcholine levels are less inside the brain. Adenosine. Adenosine levels are going down. And GABA. So GABA is the inhibitory neurotransmitter. So the inhibitory neurotransmitter levels are low inside the brain. So acetylcholine, adenosine, and GABA, all these three hormone or neurotransmitter levels are low inside the brain and the brain stem. What are the neurotransmitters that are increased when you are awake inside your brain and brain stem? The hypothalamus producing histamine and orexin. So histamine and orexin levels are elevated inside the brain. The nucleus raphe produces 5-HT. What is 5-HT? 5-hydroxytryptamine, otherwise called as serotonin. So serotonin levels are high. Locus coeruleus produces noradrenaline. So the NORAD levels inside the brain and brainstem are elevated when you are awake. Pontine nucleus produces acetylcholine, which is again low. Ventral tegmental area, VTA means ventral tegmental area. This produces dopamine, which is elevated. So to summarize, when you are awake inside the brain and the brainstem, three neurotransmitter levels are low: acetylcholine, adenosine, and GABA. All others are elevated. What are the neurotransmitters that are increased when you are awake? Histamine, orexin, serotonin, noradrenaline, and dopamine. Now, what happens during sleep? Just the opposite. Adenosine, acetylcholine, and GABA levels increase and all others decrease. So that's called as the sleep-wake cycle. So it's the fluctuation between the levels of these neurotransmitters. It's just the opposite which happens when you are sleeping. So awake, to sleep pattern. So this cycle keeps on continuing. So the levels keep decreasing and increasing. And that's how we are able to maintain a sleep-wake cycle. So it's basically the fluctuation in the levels of neurotransmitters. So let's move on to What are different types of sleep or the different stages of sleep? See, remember like this, when you say good night and when you go to sleep, we enter sleep in non-REM stage. Non-REM means no rapid eye movement sleep. And in the morning, when you get up from bed, mostly we get up from REM sleep. REM means rapid eye movement sleep. So when you say good night and when you go to sleep, you enter sleep in non-REM stage, no rapid eye movement. And in the morning, when you get up, when you say good morning and when you get up, remember we get up from REM sleep, rapid eye movement. And throughout the night, what happens? There is a changeover of non-REM, REM, non-REM, REM. So this keep happening back to back. So overall, if you see, totally you would have spent 75% of the sleep in non-REM stage and remaining 25% in REM sleep. So non-REM sleep only occupies most of the sleep or maximum sleep. And in between, throughout the night, every 90 to 110 minutes, there is a fluctuation of or there is a change over between this non-REM and REM. And that period is called as ultradian rhythm. Ultradian rhythm. So don't confuse with circadian rhythm. Circadian rhythm is the biological clock which is helping you to maintain daytime wakefulness and nighttime sleep. Day and night cycles is called as circadian rhythm. This is ultradian rhythm. During night, when you sleep, every 90 to 110 minutes, there is a fluctuation between non-REM sleep and REM sleep. But overall, if you see, most of the time you would have spent in non-REM sleep. Now let's discuss the features of non-REM sleep and REM sleep. So there are many easy methods to remember this. So I'll give you a few tricks to remember this. Non-REM sleep, no rapid eye movement sleep. So you can call this sleep as a quiet sleep. One is because there is no rapid eye movement. So just imagine you're sleeping quietly without any rapid eye movement. So it's called as quiet sleep. Rapid eye movement sleep. This is called as active sleep. Active sleep. Just a minute. So another reason why you call non-REM sleep as quiet sleep is there is sympathetic inhibition. Sympathetic inhibition. So when sympathetic is inhibited, just imagine heart rate is less, your BP is less. So that is why you're sleeping very quietly with decreased heart rate, with decreased BP. But what happens during REM sleep? Sympathetic is active. Sympathetic activation. So that's why when sympathetic is activated, heart rate is more and BP is more. So during REM sleep, increased heart rate and increased BP. So that's another reason why it's called as active sleep. Another feature of non-REM and REM sleep is, see, when you say non-REM, so non-REM, you can relate it to non-REM, not remembered, not remembered. And similarly, REM, you can relate it to remembered. So what is not remembered? See, anything that happens during your non-REM sleep is not remembered. For example, when you have a dream, which happens during non-REM sleep, you cannot recall that dream in the morning. It is not remembered. But if you have a dream during your REM sleep, a dream that happens during the REM sleep, that is remembered, you can recall this in the morning. The reason is there's something called as PGO spike. PGO spike. See, PGO spike is pontogeniculo-occipital spike. Ponto means it starts from the pons. Geniculo goes to the genicular body. Occipital, and then to the occipital cortex. And these are few spike potentials which travel from pons to lateral geniculate body to occipital cortex. See, that is why occipital cortex is your visual cortex. It is responsible for visualization. So during REM sleep, when you have this PGO spike, it goes from pons to lateral geniculate body to your occipital cortex. Thereby, you are able to visualize your dream. That is why you are able to recall or visualize any dream that happens during REM sleep because of this PGO spikes. But during non-REM sleep, there's no PGO spike and all. So you're not able to visualize or recall this dream. So what are the other things that you do during the night and which you are not able to recall in the morning? Yes, you can post it in the chat box. Yes. Yes, Dr. Harsha and Pavitra. Somnambulism. Very good, Dr. Lakshmi Priya. What is somnambulism? Sleepwalking. Very good. Prakalya. Talking. What is sleep talking called as? Somniloquy. Yes, nightmare. Nightmare we'll discuss in REM sleep, okay, because you'll be able to visualize nightmare. Any other things that children do in the night and they are not able to recall in the morning? Very common in children. Very good, Dr. Swati. Bruxism. They tend to grind their teeth. Very good, Dr. Pavitra. Enuresis. So all these are something that happens during the night and you're not able to remember in the morning, not remembered. So it comes under non-REM sleep. So what are they? Somniloquy, somnambulism. Somniloquy means sleep talking, sleep talk. Somnambulism. Somnambulism is sleepwalking. Children do grinding of the teeth, sleep bruxism. Which is called grinding of teeth. Bedwetting, that's called sleep enuresis, urination during the night. Sleep enuresis. Bedwetting. See, you can easily correlate. These are few things that we do during the night and you are not able to remember in the morning, not remembered. So in non-REM sleep, to summarize, not remembered, dreams are not remembered, sleepwalking, sleep talking, sleep bruxism, sleep enuresis. All this happens during non-REM sleep and it is not remembered in the morning. If suppose you have a very bad dream that comes during your REM sleep, a bad dream that happens during REM sleep, see what it will do. You have a very bad dream that also happens during the REM sleep. So you will be able to visualize the dream. So we tend to get afraid of that bad dream. Because of that fear, you tend to get up from the bed and shout out aloud from the bed. And when parents or friends ask you what happens, so your heart rate will be increased, your BP will be increased, you'll be so tense. That is called as a nightmare. A nightmare. So a bad dream that happens during REM sleep can be visualized and it's called as a nightmare because in REM sleep, already your sympathetic system is activated. What is sympathetic system? Your emergency system, fight or flight responses, your epinephrine, norepinephrine, dopamine, and all this is going to be elevated. On top of that, if you have a bad dream, that will further aggravate these sympathetic activation, and that's why you have increased heart rate, increased BP, you feel so tense, and you shout out aloud from the bed, and that is called as a nightmare. So remember, nightmare happens during REM sleep, not non-REM sleep. Okay, a bad dream that happens during REM sleep is called as a nightmare. So these are the differences between non-REM sleep and REM sleep. And one more clinical application of all this, narcolepsy. What is narcolepsy? So basically, narcolepsy is any defect in the level of orexin levels in your lateral hypothalamus. Lateral hypothalamus produces orexins. And if you have any fluctuation in the levels of orexins, or even you can say any loss of orexins which are produced from the lateral hypothalamus, it results in narcolepsy, because orexins are important for keeping you awake. And if you have loss of orexins, lack of wakefulness, you're not able to stay awake, you feel sleepy. And that is called as narcolepsy. So the basic pathology in narcolepsy is loss of orexins of the lateral hypothalamus. But what is the clinical presentation? So clinically, see, normally when you sleep, we have to enter into non-REM sleep first, and only then you have to go into REM sleep. What about the muscle tone in non-REM sleep? In non-REM sleep, you have to do sleepwalking, sleep talking, and all this. So for all this, you need some amount of muscle tone. So remember, in non-REM sleep, muscle tone is only slightly decreased. Muscle tone slightly decreased. Remember, like this, you have to walk and talk and all. So for that, you need some muscle tone. So muscle tone is only slightly decreased. But in REM sleep, except for your eyeball muscles and diaphragm, there is complete loss of muscle tone. So muscle tone is completely lost. But except for your eyeball movements, because you have to do rapid eye movements. So except for eyeball movements or eyeball muscles and your diaphragm, because you have to breathe, all other muscles, you'll see that muscle tone is completely lost. So how do you normally sleep? You enter into non-REM sleep. Your muscle tone is slightly decreased. Then you enter into REM sleep, where muscle tone is completely lost. But in narcolepsy, what happens when you have loss of these orexins? You skip the initial non-REM sleep and directly enter into REM sleep. So you skip this and directly enter into REM sleep. So now what happens? The patient, he will not experience this initial non-REM sleep. When you directly enter into REM sleep, there is sudden loss of muscle tone. So that's why they will fall asleep like this. You would have seen in movies, right? All Hollywood movies, or even a Tamil movie, Naan Sigappu Manithan, where Vishal, what happens when he faces any emotional situation or anger or anything, he'll suddenly fall like that. He'll sleep and he'll fall like that. So what that is called as cataplexy. What is cataplexy? Sudden loss of muscle tone. So why there is sudden loss of muscle tone? Because narcolepsy patients, they skip the initial non-REM sleep and directly enter into REM sleep. So directly there is sudden loss of muscle tone. That's why they sleep and fall like this. Say you would have experienced this in your lecture classes. Even now, some of you might be experiencing cataplexy. When you're listening to the class, suddenly you'll fall and sleep like this. Your head goes like that. Sudden loss of muscle tone. So something like that. That is called as cataplexy. So sudden loss of muscle tone in narcolepsy patients is called cataplexy. So this is one feature of sleep related to narcolepsy. So these are the basic differences between no rapid eye movement sleep and rapid eye movement sleep. So to summarize, no rapid eye movement sleep is quiet sleep. Why is it quiet? Because sympathetic is inhibited. No rapid eye movements. You're sleeping quietly with less heart rate and less BP. But REM sleep, active sleep, because sympathetic is activated, you're sleeping actively with increased heart rate and increased BP. And not remembered in non-REM sleep. What is not remembered? Dreams are not remembered. Sleepwalking, sleep talking, sleep enuresis, sleep bruxism, all this is not remembered. In REM sleep, dreams are remembered. Why is it remembered? Because of PGO spike, which starts from pons, goes to geniculate body and then to visual cortex. You are able to visualize the dream. That's why you are able to remember the dream. But if a bad dream happens during REM sleep, that is called as a nightmare. Why it's a nightmare? You get up from the bed shouting, because already in REM sleep, sympathetic is active. On top of that, you have a bad dream. So it further aggravates the sympathetic activation and it's called as a nightmare. And narcolepsy, you skip the initial non-REM sleep and directly go into REM sleep. So you have a sudden loss of muscle tone, that is called as cataplexy. So hope you understood the differences between non-REM sleep and REM sleep. Yes. Next, let's move on to sleep waves and the EEG pattern. So look at this diagram. See, what is EEG basically? Electroencephalogram. So how is this technique done? You connect electrodes all over the scalp and you record the potential activity, electrical activity of the brain. So that is called as EEG. So by doing EEG during sleep, that's called sleep study, you will be able to identify sleep disorders. Because you ask the patient to go to sleep, you put the patient to sleep in a silent, dark room, you connect electrodes all over the scalp, and you start recording the electrical activity of the brain. So starting from the first stage of sleep until he gets up in the morning, throughout you record the electrical activity of the brain. So you will see that you can see different types of waves. So they are called as sleep waves. So now let's see, how do we correlate the different types of sleep waves to the different stages of sleep? So our mnemonic works well here. So what is the mnemonic? At night, bats drink blood. So at night is to tell you that we are recording these potentials during the night. So the mnemonic is bats drink blood. B-A-T-S. Bats drink blood. So how will we correlate this with the waves? So starting with B. So just imagine this. When you go to sleep, how do you go to sleep? So when you go and lie down, immediately do you sleep? No. So all of us will stay awake with our eyes open. So when you go to bed, we don't sleep immediately. For some time, we will remain with our eyes open. So the first stage is eyes remain open, which means you're actually awake. So at this stage, EEG will record beta waves. Then what you'll try to do, we will close our eyes and we will try to sleep. But you haven't entered into sleep yet. You just stay relaxed and calm with your eyes closed and you are trying to sleep. So the next stage is eyes closed and you are in a relaxed state. So at this time, your EEG will record alpha waves. So alpha waves are seen during relaxed state with eyes closed. So when you're staying like that, relaxed with your eyes closed, suddenly your exams come to your mind. So now what happens? You will wake up suddenly. So from alpha, your rhythm changes to beta. So that is called as alpha block or arousal response or alerting response. It's giving you an alert. Don't sleep, go and read. So suddenly when your exams or something very bad comes to your mind, you wake up like that. So from alpha, the rhythm changes to beta. So that's called as alpha block. So what is alpha block? When you are relaxed with your eyes closed, and when you concentrate or focus on something, your pattern changes from alpha to beta. That's called as alpha block. And now you enter into the next stage. See, now only we are going to enter into the actual stages of sleep. So the first stage of sleep, non-REM stage 1. So at this time, EEG will record theta waves. Then you enter into next stage of sleep, non-REM stage 2. At this stage, it records sleep spindles. Sleep spindles. So sleep spindles are characteristic of non-REM stage 2. Then you enter into next stage, non-REM stage 3. This is actually called as the deep sleep. Okay, deep phase of sleep, non-REM stage 3. At this time, you record delta waves, or even you can remember like this, D for D, deep sleep delta waves. Okay, that is non-REM stage 3. And some books also give you non-REM stage 4, which also records delta waves. And then it changes to REM sleep, where you record beta waves. So these are the stages of sleep and the corresponding EEG waves. So with the wave pattern itself, you can identify the stage of sleep, and anything abnormal in the wave pattern can tell you about the different types of sleep disorders and during which stage it has occurred. REM sleep especially is called as paradoxical sleep. Paradoxical sleep. Why is it called as paradoxical sleep? What is a paradox? Yes, Dr. Mayamai, K complex is also seen during sleep spindles. So along with sleep spindles, thank you for reminding that. Along with sleep spindles, you see K complex. Yes. See, what do you mean by paradox? Anything that is very weird or controversial is called as paradox. So what is so controversial here? Beta waves are the waves that are seen when you are awake. But the same beta waves are also seen during REM sleep. This is something controversial. No, beta waves should be seen only when you are awake. But on controversy, beta waves are seen during REM sleep, which is a type of sleep. So during REM sleep, you're seeing a wave that normally happens when you are awake. So that's a paradox here, something weird, something controversial. That's why REM sleep is called as paradoxical sleep. And what are the other important clinical correlations here? Non-REM stage 1. This is more prone for hypnic jerks. What is hypnic jerk? All of us would have experienced this. See, can you remember an experience like this when you were sleeping and suddenly you would have got some dream, like something a weird pattern, and you will feel like as though you are climbing a mountain or you're climbing a step, and you will actually step up when you are sleeping. You'll try to raise your legs and do like that, or you're falling from a falls. Yes, have you experienced this? Has anybody experienced this? Very nice experience. That is called as a hypnic jerk. Nobody has experienced this. I have experienced this so many times, as if I'm falling from the Niagara Falls, or you're falling from a step, or you're trying to climb up something. Yes, always. Yeah. So all of you are very good. So all of you have felt this feeling. That is called as a hypnic jerk. So that is more common during non-REM sleep 1. And non-REM 2, that is more prone for bruxism. or teeth grinding is mostly seen in non-REM stage 2. And what is the other important feature of non-REM stage 2? Which sleep stage occupies the maximum period during your sleep throughout the night? Non-REM or REM? Which is maximum? Yes, I'm happy that all of you are not feeling lazy and you are typing the answers. Very good. Non-REM, very good. Non-REM only occupies 75% of the sleep. Out of that 75%, 50% is contributed by non-REM stage 2. So overall, you will see that non-REM stage 2 only contributes to maximum sleep. Out of the 75%, it occupies 50%. So this is non-REM stage 2. Non-REM stage 3, sleepwalking is more common in stage 3, sleepwalking. So these are some clinical correlations of the stages of sleep and about the pattern of sleep. See, because I think 2020 NEET exam, there was a question on the EEG waves or the sleep waves, and they were asked to identify the stage of sleep. So you should know how to analyze the pattern of the waves also. So how will you identify the waves? So look at the waves from beta to delta waves. So this is beta, alpha, theta, and some sleep spindles and delta waves. So which waves you think are the tallest waves? Which waves are highest in amplitude? Yes, which just see from the diagram. Very good. Delta, obviously delta. So from this itself, you will be from the height of the wave, you should be able to identify the type of the wave. And correspondingly, the stage of sleep also you can identify. So delta waves are the tallest, or you can say highest amplitude. Highest amplitude. Which wave you find is the shortest wave or the lowest amplitude? Yes, obviously the beta waves. So beta waves have lowest amplitude or the lowest height. What about the frequency? Which wave occurs more frequently? Just the opposite. Beta waves, see, they occur more frequently, but delta waves, they occur less frequently. So beta waves have highest frequency and delta waves have the lowest frequency, which means they occur less frequently. So with the height and the frequency, to some extent, by looking at the waves itself, you can identify the type of wave. So if you're able to identify the type of wave, you can correlate it with the stage of sleep during which it is occurring. So this was a 2020 NEET question. Yes, take it down. Let me show you that question. Yes, please, if you're taking it down, take it down. Sleep is a very, very important topic because every year we find repeatedly questions from non-REM sleep and REM sleep. So sleep physiology, please give more importance when you're learning. See, topics like this sleep physiology, speech physiology, your cerebral hemispheres or emotions, learning, memory, hypothalamus. So all these are topics where you can score very easily. Not much of concepts, not very complicated. They cannot twist the questions that much. So topics like this give more importance because any question from speech or sleep physiology or learning, emotions, your amygdala, all this, anybody will be able to answer. So you should not do mistakes in topics like this. Okay, where easy topics are the areas where you should be able to score more, because anybody who is reading for even for one time will be able to answer these type of questions. So don't get mistakes. You want the last slide? Okay. So don't do mistake in easy topics like this. Okay, never mind if you are not getting difficult topics, but easy topics, it's unforgivable if you're making a mistake. Is this slide you want? Second page. I think this is the second page. This one, okay. Done? Okay. Yes, let's see if you're able to answer this. NEET 2020 question. And the wave which was marked here was this one. This was the question. What is the answer now? Identify the sleep wave marked in EEG during a sleep-wake cycle. Yes, please think and answer. Don't be very fast to answer. Very good, Dr. Swati Prakalya. Yes, Dr. Harish, Anita. All of you are right. Very good. A few of you are wrong. Never mind. So look at the wave pattern that is shown. So you can see very small waves with high frequency. So the wave shown here is actually beta wave. When will you see beta waves? One is when you are awake. The other is during REM sleep. So the answer is REM sleep. So please don't go for sleep stage 1. Some of you are saying sleep stage 1. Sleep stage 1 is actually NREM 1. Sleep stage 2 is NREM 2. Sleep stage 3 is NREM 3. Okay, non-REM sleep only is the sleep stage. So when your eyes are open, that is not a stage of sleep. You are awake there. Okay, so don't go for sleep stage 1, as many of you have answered A. Answer is D, REM sleep. Alpha waves are seen during NEET 2018 question. When will you get alpha waves? BATS. Yes, when you are closing your eyes and when you say relaxed, you get alpha waves. Very good. Yes, very good. All of you are right. Very good. So alpha waves are seen when you are in a relaxed state. Delta waves on EEG are recorded. Just think and answer. When do you get delta waves? So beta waves, alpha waves, theta waves, sleep spindles, and after that you get delta waves. So when it is seen, D for D, deep sleep. Very good. So delta waves are seen during deep sleep. So all these are your repeat questions. Yes. Thanks a lot for this morning session. So hope you get all answers right from easy topics like this. As well, meet you in another topic in the next session. So thank you all of you. If you have any doubts, you can post it in the chat box. Thank you. Have a nice day. Yes. Thank you, Dr. Shiba, Aisha, Tanuja, Dinesh Kumar, Vijay, Satya, Harsha. Thank you. See you in the next session.